Turning now to Medicaid protection, Target 12 has been tracking Rhode Island's re-enrollment process that started last May.
It kicked thousands of people off the health insurance program and is forcing them to get covered elsewhere. Target 12 investigator Sarah Granelli is here now with where the process stands. Sarah?
We spoke with one man who didn't know he lost his coverage until he went to get his prescription filled, and the state is now working to re-enroll the largest group of Rhode Islanders, families, and children.
Like, what do you do?
Gregory Duffy says a few months ago he went to get his prescription medication, then found out he was no longer covered by Medicaid.
I'm thinking maybe I'll have like a $20, $30 copay. When she told me that I had a $600 copay for one of my meds, $500 copay for another one, and $200 for another one.
He tells Target 12 when he tried calling the Department of Human Services to figure out what was going on, he was left waiting on hold.
Called there one day, and I was put on hold, and I was like number 300 and something in the queue at 9 o'clock in the morning.
A Target 12 analysis of DHS wait times since August shows Rhode Islanders who call with Medicaid questions on average wait on hold for an hour. The average time last winter was also about an hour, more than half the state's target of 30 minutes. We sat down with DHS Director Kim Brito and State Medicaid Director Kristen Souza. Why hasn't that really changed at all?
We see the wait time fluctuate. It goes to the hour mark. It comes back down to the 47, 49-minute mark, but it really does stay around that.
Duffy says he also walked into a DHS office in Pawtucket to be turned away.
You can't get through on phone, you can't get through in person. It's like, what do you do?
Brito says DHS is dealing with a large volume of people daily.
There are times when our office does hit capacity, and when customers come in, if there's not a scheduled interview and we've reached full for walk-ins for the day.
Duffy's Medicaid issue comes as the state is now re-enrolling the biggest group of people, families and children. According to the latest data from January, nearly 3,000 children lost coverage, compared to roughly 18,000 who were re-enrolled. The state has reached out to the families of another 800 children, but haven't heard back. How do you know there aren't kids out there that don't have insurance? Is there a way for you to track that?
We track children's churn, meaning children that come on and off and where they may end up. There is not a surefire way to know if every child is covered.
The state is in the home stretch of this year-long process that started last May after a pandemic-era moratorium ended. The normal process of re-enrollment every year will begin again this spring. And as for Duffy, he says he recently got a letter from his health provider stating he's back on Medicaid with no explanation as to why. With the Target 12 investigator Sarah Granelli, 12 News.